Welcome back to Therapy Thursday. Today we're going to show you, first off, I have Larissa Robinson with me today, our superstar massage therapist here at the Proactive Athlete. And I brought Larissa in as our expert on soft tissue disorders. We're going to take a look at trigger points. What are trigger points? Trigger points are tight, irritable areas of muscular soft tissue fascia that often will have a radiating or intensity to them that some people will just know as muscle pain, but will often cause radiating patterns that might not be as recognizable. So we thought it might be fun to do a top 5 trigger point therapy, things you can do at home for areas you might never have thought to do some soft tissue work. So we did a little draft. I drafted first overall and picked the posterior shoulder, infraspinatus and teres. Number 2.
I picked the in between the scapular space, so rhomboids muscles.
The 3rd draft pick was the lateral hip, the glute med min, a real gnarly area to get into that I think we'll have some fun with. Number 4.
I picked the posterior hip, so we'll get right into piriformis, which is probably one of the most famous muscles in the body for being a pain in the ass. And last, we'll go through the occipital group, which are right at the base of the skull and are a big headache pain.
Absolutely. So we'll get right into it. So the first one, the posterior shoulder. I've got a gnarly posterior shoulder situation from some overhead work. So how do these things come to be? Usually repetitive strain, possibly some occupational postural demands. In this case for me, my posterior shoulder has been giving me some trouble because I've been doing some overhead work. So a good way to landmark this is just come off the acromion, that bony area at the top of the shoulder, and fall just into the back side of the shoulder. I'm going to use a lacrosse ball for this one. It's got a little bit of play to it, a little softer than say a hard ball. And I'm going to landmark that bony part at the top, get into the back of the shoulder, and apply a little bit of pressure. And in my situation right now, if I lean into this with the right amount of body weight, I can reproduce some pretty intense pain in the back of the shoulder. And if I get in just the right spot, I can get some radiation down into my hand. And it almost feels like my hand's going to go asleep. You can do a little bit of roll over the area to see if you can find some intensity. But ultimately, you want that deep sort of ache and come off of it. So we're going to roll into it, bring that intensity on, and in this one, adding a little bit of internal rotation for that teres minor and infraspinatus can be helpful. That's our posterior shoulder. Larissa's up.
All right, so this piece of equipment you're going to use, I'm going to use the gym space, but really all I want is a corner. So anywhere you have a sharp corner, so 2 walls that come together and make a corner will work perfectly fine for you. You're going to lean up against this corner and you're going to hook in the medial border of your scapula, so it's right at the edge there. You're going to sink in a little bit so you can give yourself some power through your legs, and then what you're going to do is you're going to push in to that medial border of the scapula, pinning the insertion point of the rhomboids along there. And just like Dave did with some rotation, this rotation you can do here by bringing your arm back a little bit. It'll make the shoulder blade pop out a little bit so you can hook deeper and then push in. You can go back and forth just a little bit over the spot if it feels good. You might feel this come through your chest. This is a spot that sometimes feels tightness in through here, but it's actually at the back of your body.
Cool.
Over to Dave.
3rd, the lateral hip, your glute med or min. When you get into a good spot in the lateral hip, some people will actually feel radiating pain down the leg. This can be called sciatica, a little bit of a garbage bin term, but the idea here is if you get the right spot in your lateral hip, it can radiate all the way down to the outside of the ankle. I like either a harder ball or a foam roller here. I'll demonstrate with the hard ball, or the 11-inch more appropriately. And again, I'm going to go in the semi-prone position and landmark that bony spot, the greater trochanter, that bony spot on the outside of the hip, and come just above it. Your glute min is a little more towards the front, and your glute medius is a little more towards the back. And if you find the right amount of body weight and the right spot, again, you'll likely find a zone or a band or a spot that causes some intensity to it, and that's the area that we want to focus on. Lean into it, let that intensity build, but we don't want to hang out here forever, and we don't want to aggravate this, so we don't want to spend too much time. What's the right amount of time? For each person, it's going to be a little bit different. As a general rule, we'll say no more than a minute of deep, intense ache in that spot without giving your body a break. Number 4.
All right, I'll take that. Thank you. This is the piriformis. So the piriformis is going to landmark similarly to where Dave had you. So you're going to find the bony part of your hip right at the side here, the greater trochanter, and the lateral edge of your sacrum. So that triangle bone right at the base of the spine there, that's going to give you the angle you want to work through. So if you're using a ball, you're going to sit right on it, on that spot. And so you're in the meaty, meaty part of your buttocks. And what I like to do here is have this leg that I'm not treating the side of up so that I can push some body weight through there and I can put appropriate pressure for what feels right for me. And then I will find that sweet spot. And this spot may make you feel a dull ache going down the back of the leg. It can feel pretty broad along the hamstring muscle group as a referral, but it can go all the way down to the foot. And if you want to, you can even add a little rotation and you'll feel that muscle pop up and kind of meet the pressure of your ball. And I kind of want to sit here for a really long time, but I'm going to let Dave take over again.
Well, I think you got the last one, the suboccipitals, right?
Oh, I lied. So, turning over to the back of your skull here. The suboccipital group are tiny, tiny little muscles. So we're not going to actually try and pin them specifically. We're going to use the pads of our fingers, not the fingertips. And we're going to go just behind the ears here. And you're going to find where you have a little bony protuberance here called your mastoid process, and you're going to come under it and kind of give your fingers a nice line of attack. You're going to tuck your chin in, so you're looking a little bit at the ground, and then you're going to push up in through the hairline with the angle of your force going to your skull and up above your head. So you're creating a little bit of drag on the tissues in addition to just pushing into your skull. This will feel really good. This is really good for those headache type pains that come right over here or over onto the eye, sometimes localized right in that actual spot where they exist.
So we're just having some fun with the top 5. Honorable mention, upper fibers of trap. Great little spot to try and use your opposite arm, fingertips, and do some movement release here. These are some options for soft tissue release. Obviously, trigger point release can be any soft tissue area that you can create that intensity, that ache. There are some great trigger point diagrams you can find online to see where radiating patterns might be coming from. And if you can't figure it out, find yourself a good massage therapist like Miss Larissa Robinson. See you next week on Therapy Thursday.